Alrighty, everybody, let's go through a little bit more regarding pharmacology. Okay, so medication administration. So a lot of this is aimed more like in the inpatient setting or the nursing world or such. So forgive me, and James will help you kind of adapt this more to what everything would look like for you guys. But so I'll give you kind of this framework, and you guys can do with it what you see fit. So when it comes to medication administration, there's what's called the 5 rights and 3 checks. Okay, so the 5 rights of medication administration is the right patient, right drug, right dose, right route, and right time. Essentially, these are all things in order to try to help decrease medication errors. Okay, so it's pretty straightforward as to why these are the rights of medication administration, but to be overly transparent, let's go through it. So right patient, obviously we want to make sure we're giving it to the right person. The right drug, we really don't want to mess that up. The right dose, I feel like, is a pretty often place of medication error. Right route, pill, IV, IM, whatever it is, and then at the right time. A couple of ones that I would add on to this is right documentation, whatever that looks like for you guys. And then also people have a right to refuse their medication. Okay. And then also for the right reason. And, in the nursing world, we're considered like the last line of defense when it comes to medicines for our patients. And so, and really that applies to anybody that's actually administering medication. If you're the one that's handing it to them and then they take it, you're involved in this. Okay. So that's part of why we're going through this, to make sure that you guys have at least a basic understanding of what's going on and what to look for. Okay. I'm not trying to say that you need to have a super ridiculously thorough knowledge of, all the different indications for a medication, but you do need to be aware of that. Okay. And then the 3 checks are, you're supposed to check these 5 rights 3 different times to ensure you're doing it correctly. So in the nursing or the inpatient world, typically that means you use the patient's name and their date of birth to verify the patient. And you do the first check when you're actually pulling the medicine out of the Pyxis, which is the like medication holder box thing. You check it again when you're getting ready to give the medicine, and then you check it for the 3rd final time right before administration. And it's hopeful that in these 3 checks that if one of these rights is wrong, you would catch that. Okay. So just be thankful at this very moment that you're not in my nursing lab courses at Gonzaga, because we make you go through in excruciating detail demonstrating these 3 checks. And so we're leaving that up to James to see what all he's going to put you through. This is a YouTube that goes into a little bit more about the 5 rights. And like I said, it's based off of the inpatient world and the hospital background with nurses, but you'll adapt it as he sees fit. So here's really why I'm chatting with you today is, why do we care? Why do we go through those 3 checks? Why are there all these rights? Why is it such a big deal? And so medication errors are a huge problem. Okay. More than 100,000 medication error events are reported to the FDA each year. And there's a big variety of possible outcomes. Unfortunately, some are fatal. Some result in loss of limb. Some result in, delayed care and worsening of primary conditions. And other are really not that big of a deal. So when you report these medication errors, you try to evaluate what the harm, like the level of harm that was done to someone. I bring up the dosage as a big cause and a big source of error. And I have personally in my career committed multiple different medication errors, and thankfully nothing serious happened from it. For me, most of the time one that comes to mind is I got super busy and was popping out somebody's pills, and they had like 15 of them. and I forgot to cut one of them in half. And so they technically got a double dose of something. And I realized it maybe 5 or 10 minutes later, and it was a blood pressure medicine. And so I had to check their blood pressure a lot and keep an eye on their heart rate. And thankfully, nothing really happened. And just in my own career, I've seen people get an entire bag of heparin. Heparin is an medicine to help stop your blood from clotting. Somebody programmed the pump wrong, and they were supposed to be, the patient was supposed to be getting like 11 milliliters, which isn't very much at all, like 11 milliliters an hour. And they got the entire bag in like 10 minutes, which is like, I think like 250 milliliters. So obviously that's a huge, huge medication error. And so depending on the spectrum, that like with mine, I had to keep an eye on, their blood pressure and heart rate for a little bit. It wasn't that big of a deal. This one could have had really serious events. That person could have developed like a GI bleed or a brain bleed or all sorts of, if they were post-surgical, their surgical site could have bled. It's a big deal. And like we talked about in our last conversation, even over-the-counter medicines can have a lot of risk with them. Okay, so we talked about aspirin, or even the side effects, of ibuprofen or Tylenol. So it's a serious thing to be involved in this in any matter. And so I'm not saying all of this to scare you or freak you out, but it's a serious thing that you're doing. And it's easy to kind of fall into the mental trap of, oh, it's over the counter, it's not that big of a deal, people take it all the time. And it's like, no, it's still important that we get this right. And it's also important to give yourself the grace if you do make medication errors. Like I said, I've made multiple in my career. And you try to put steps in place to make them as infrequently as possible. But give yourself the grace afterwards, because everybody makes mistakes. This is a YouTube to help you go through dose calculation, because that can be a big stumbling block for people. It's based off of the principles of stoichiometry way back from chemistry class, when you have to convert to different units and such. And so James will be helping you go through that in a little bit more detail. And then we talked about in our last conversation about, inhalers and how to use them appropriately. The first video is using a meter dose inhaler with a spacer, which you'll find happens a lot more often in kids because they can't be instructed well on how to actually inhale appropriately. And so that we use the spacer. But, once it comes to adults, very rarely anybody actually uses a spacer. And then keep this in mind always, we all have that time when it's, the first time we do whatever it is. And so it's okay to just, grin and bear it and get through it. And one beauty of masks right now is maybe people can't see all the panic behind your face. At least where I'm working, it's a beneficial thing. So James will help direct you further, and we'll talk again soon.